Hi, good day. This is my submission for the Google MedGemma Hackathon Challenge. I built an oncology irAE detection assistant. Every year, thousands of cancer patients die not from their cancer but from the side effect of their treatment, immunotherapy. Immunotherapy saves life but can also trigger dangerous immune attacks on the patient's own organ. Doctors call this irAEs, immune-related adverse effect. The problem is they are easy to miss until it is too late. And why is this so? Because of the fragmented clinical data. A grade 2 irAEs can progress to grade 4 within 48 hours, and my system or my solution is to detect the grade 2 pattern before escalation. And by so doing this, we'll be saving lives. At 15% global mainstream, we'll be saving over approximately 2,300 lives per year, and we'll be saving, from my calculations and my findings, over $4.5 billion per year, and there will be increased free resources. And the clinical impact for the well-being, that's if the solution prevents even 5% of burnout-driven attrition, it preserves approximately 50 oncology in practice annually, equivalent to treating 50,000 more cancer patients. And the ripple effect and the every week mainstream adoption, over 44 lives will be saved, and the 10 years community impact will be 22,426 lives saved per year. So this is the solution implementation. The oncologist will enter the patient clinical data either as a free text input or as a structured input. So if it as a free text input, the oncologist will enter the patient's ID, the age, the cancer type, medications, symptoms, laboratory results, clinical notes, and then click on the button analyze for irAEs. So this implementation, I use MedGemma 4B instruction tunes. Now, I was able to apply it in 3 places: to detect, to grade, and for triage. Now, for detecting, it's used to detect the irAE patterns across 9 organ systems: GI, liver, lung, endocrine, cardiac, neuro, skin, renal, and hematologic. And then to grade, I applied CTCA grading, which is the gold standard for oncology toxicity, to classify severity from grade 1 mild to grade 4 life threatening. And then triage, that is to assign urgency level: grade 3 hepatitis, same day evaluation; cardiac involvement, always emergency, cannot be overridden; patient safety is hard coded. Now let's review the results given by the model. So you can come here, you see the summary, severity, key supporting evidence, assessment confidence. Then you see the organ system and the detected and the confidence level, and then you see the recommendations, recommended actions, and the general area management principles. And then you see the full report. So you can see how it's able to detect the irAE. Then you can see how it's able to grade it, the grading it gave to it, and then you can see the triage, needs oncology review soon. So you can get the full report and also download the full report. So this is the technical architecture of the oncology assistant. So after the diagnosis passes the parser to the MedGemma, then rule-based safety, then to the safety validator, then to the assessment, in which it gives us this output. Now, why do we use MedGemma instead of other AI models? Because MedGemma was specifically trained on clinical data, which is a perfect match for the project that I built, which needs or requires clinical data. Then I use the terminology to ensure safety, to ensure that the user is safe. And then my test coverage covered the CTC grading test, the organ system test, and the safety test. So now this isn't about replacing oncologists, it's about giving them superpowers: catching the grade 2 colitis before it becomes grade 4, flagging the subtype troponin rise that signals myocarditis. Because in oncology, every hour matters, and no patient should die from a side effect we could have caught. Thank you.